Yeah, good evening. So I am Divyansh and thank you one and all for inviting me to discuss this topic. This one is a very simple topic and mostly choose for the ease of convenience for the patients. We actually looked for the tele interpretation of pathogy test, especially in a non-endemic country like ours. It was co-investigated by Dr. Anu and I don't have any financial interest here. First, to understand the basis disease, it is actually a chronic inflammatory vascular condition of unknown cause. And usually patients present with a recurrent oral aphthous ulcers or genital ulcer with skin and ocular symptoms. The diagnostic challenge here is that it does not have any specific laboratory investigation for diagnosing except for one pathogy test and one HLA-B51, which is not a very sure test here. So usually for a pathogy test to interpret, we usually have to call the patient on day 1, that is 24 hours and 48 hours after giving a sterile prick with a needle. So pathogy test is included in both the international study group criteria and the ICBD criteria for diagnosis of BASITs, and that's why we took this test for seeing the feasibility of the pathogy test, and also second thing is to see whether it is effective in a non-endemic country like ours. So it was a retrospective study. In that we had already sent images of the, like we had already told patients to send their images on day 1 and day 2 after doing a pathogy test. But the most important thing was what is the positivity of the pathogy test and how would a patient calculate them when they are at home. So for that we thought we would use a Schirmer strip. It is a very simple strip which is available everywhere, and this could actually save 2 days of the patient coming on day 1 and day 2. We gave them the representative images that how would they calculate it, and a positive test was actually defined with a more than 1 mm of a nodule or more than 3 mm of the erythema, as you can see here. So you can see here one nodule which is comparing with the Schirmer's test, which is more than 1 mm. So this is a positive pathogy test. So we had actually 50 suspected cases of Behçet's disease, in which we suspected based on the typical ocular symptoms of like a ferning pattern on FFA or transient retinitis, and out of which 12 actually fulfilled the ICBD criteria. And we did pathogy test only in these 12, and then we did in all, but in these 12 we found that 9 were positive. These were the gender and the age distributions, which were like a secondary objectives in our study. The main thing was whether this test is feasible. So we were able to get good images of 10 patients out of 12, and we could say that the feasibility was 83% based on this, because good 10 images which could have been classified as positive or negative were given. We did a 2 by 2 table, which is a very simple thing to understand. Out of 50 cases, we had 12 BASITs positive, in which we had 9 positive pathogy tests, in which 8 were true positive and 1 was false positive. So a sensitivity of 67% as compared to the literature which is available is present here. So we can say that this test was feasible and had a good sensitivity as per the literature, even in the non-endemic country. But there were some challenges, as I told you, about the image quality, about the connectivity issues, and the standard protocol which was not available to us. So a more important thing is we need to do a more prospective kind of study so that we could get a good specificity out of it in this study. Thank you. Thank you.